Okay, hello everybody. My name is Jenny Bess and I am thrilled to be here. Thank you so much, Michelle, for the introduction. Audra and Kathy and I are really looking forward to a productive discussion with all of you around advocating for a safe return to school. We know that all of you feel the sense of urgency in the same way we do around this topic, as we're experiencing it in our practices and within our families and in our home communities. We are really proud of the stance that Knapnapnap has taken in response to this issue and recognize that as experts in pediatrics and advocates for children, we must have a seat at the table in ensuring that our children are safe as they return back to school in this ongoing pandemic. We've all seen the headlines and they are shocking and frustrating and worrisome. And we'd love to hear your thoughts on how you've been experiencing this return to the pandemic. So in the chat, feel free to let us know where you're from and tell us if you were to describe this return to school experience in one word, what would it be? And of course, there's no right or wrong answer. A range of feelings would be totally appropriate given the difficult situation that we're all facing. We wanted to begin by just introducing ourselves and telling you a bit about our home states and the climate that we're each practicing in. Interestingly, the three of us come from three southern states that have taken very different approaches to the return to school initiatives. Our governors remaining neutral, actively opposing mask mandates, or actively supporting mask mandates, and we are all struggling. Here in Georgia, we're having a particularly challenging time. Our we've had over 1 million cases of confirmed COVID-19, over 20,000 deaths. And our current rate of hospitalization and ventilator use among adults is near the peak that it was in January. We've had 12 youth between the ages of 1 and 17 pass from COVID, and our schools are struggling without any oversight from our state government, which is allowing the schools to individually come up with their own strategies for how to address the return to school safety precautions. We are a state that has not expanded Medicaid, and we have a particularly vulnerable rural healthcare system. And so this has been a challenging time in Georgia. And I think many of you may be experiencing similar things in your own states. And I'd like to pass it off to Audra to tell us what she's experiencing in Kentucky.
So I think, like many of you all, there's so much variance in what each county is doing and what different school systems are doing. In the state of Kentucky, our governor issued a statewide school mask mandate, which was certainly aligned with Knapnap's position statement and the AAP, but that order was rescinded due to a legal challenge in the court system. What's happened since then is that the Kentucky Department of Education and the Department of Public Health have issued mandates for school masks. So even though we don't have a statewide mandate at the state level, we have independent mandates. What makes that really tricky, though, is that in the Department of Education, private schools don't have to abide by that mandate, but most are abiding by the Department of Public Health mandate. And so we're not seeing consistency from school to school. So I think it makes it very, very confusing and very controversial. Like many of you all said in the chat, it's frustrating and it makes our messaging really difficult, I think, as advanced practice nurses, because we, are having some schools that are doing one thing and other schools that are doing other things.
Can you hear me? I'm sorry, I had trouble getting on, so I used my phone. So I'm at work still. So this is Kathy Lutz. Can you hear me?
Yes.
Wonderful. Okay, cool. So I guess I came in a little bit late, but do you want me to talk about Texas a little bit?
Yeah, just tell us a little bit about the climate in Texas, please. Okay,
so Texas, I think probably everyone has heard on the news about Greg Abbott and about many of you may have also heard about the our court, our judge, Clay Jenkins, talking about how the PICU at Children's in Dallas is full and there's no room for any other children to be in it. And it made nationwide news because he made a kind of a dramatic headline that a child would have to die in order for another child to get an ICU bed, which of course that's hyperbole for sure. But it is definitely of concern because we are out of beds. And so I think a lot of our cities are pushing back against some of the state mandates. And I think we've got some real champions in there, but it's frustrating as a nurse practitioner to try to deal with, and support families who are afraid and worried. So, the politics and the conditions are very dire right now. So.
Sorry, I'm muted. So what we want to start off our talk with tonight is to discuss a little bit about what we can do about, this mixed messaging and, what our position as Knapnap is and how we can communicate that really clearly through a couple of different steps. So for those of you all who aren't familiar with our position statement, Knapnap came out with a really wonderful guide that stresses the importance of using a multimodal mitigation strategy to support return to in-person education. And so, I think it's really important to remember that our kids who are 12 and younger aren't old enough to get vaccinated and are at a higher risk because of that. And so using a comprehensive approach where, certainly if vaccination is appropriate, if they're age appropriate, to encourage that, but also encouraging universal masking in schools, whether it be with vaccinated teachers and staff or unvaccinated kids, but really stressing the importance of everyone wearing a mask, but not just masking, having an approach where we also, really stress the importance of hand hygiene and physical distancing, which everybody's familiar with after, months of doing this. But I think with the laxity and these strategies, when vaccination rates were increased, a lot of times we, need to be reminded of this in schools. So really stressing, masking, hand hygiene, and physical distancing is important. In addition to that, schools need to have appropriate ventilation systems. Having appropriate surveillance systems in place is going to be important. I think one thing that is really important to mention and sometimes is often overlooked is mental health support. So making sure that we're providing adequate mental health support to kids, and then also making sure that kids and staff and faculty have adequate opportunities for COVID-19 testing in the event that they are showing symptoms or have been exposed to somebody who's positive, whether or not they're vaccinated or not.
Okay, so how do we get started in implementing the Knapnap official position statement and advocating for this multifaceted approach to protecting kids and families? We like to propose that we focus on how we connect with our educational leaders, policymakers, and the families in our local schools, how we communicate effectively with them, collaborate with our community partners, and finally celebrate our successes when they do occur. And so we're going to walk through each of these, and we'd love to hear your best practices in the chat, other ideas and things that you guys have done, and we will highlight a few chapters as well. So starting with connection, this is really important because this is the relationship building piece. Again, we have multiple players at the table here. We have our elected officials, our school leaders, and our families. And relationship building is really something that happens best over time. And so while we do want to aim for year-round engagement, we know that even if we haven't formed that strong relationship with the schools yet, we have a compelling reason to do so now. And so to connect, again, working on that year-round engagement, we want to stay informed about what's going on in the schools. And this can be really challenging and exhausting. We're taking care of our patients every day, and we are overworked and understaffed and have a lot on our plates. But as experts in pediatrics and advocates for children, we really need to know what's going on in our local communities. And we want to work with all of our partners in finding common ground. We do this every day in our clinical practices when we deal with things like vaccine hesitancy or chronic disease management, and we need to employ that now. We know that the pandemic, unfortunately, has become highly politicized and is very polarizing. But we need to come together around wanting to keep kids and families safe and healthy. And I think at the core, we can all agree that that should be a shared value within each of our communities. Building relationships, again, just takes time and finding that common ground. And we also want to remember that as advanced practice registered nurses, we are among the most trusted healthcare professionals. And that as difficult as this time has been for all of us professionally and personally and within our families, our school districts are really struggling as well. And so we need to think about the ways that we can help serve our districts, support them in making these decisions, guide them with credible information and resources, and be there at the table with them to support their decisions and celebrate them when they're making good choices, sometimes that are hard choices, potentially in a given political environment. And one chapter I just wanted to highlight, this was from my home chapter of Georgia, and just one example of how we had partnered with a school district in the past. At the start of the pandemic last year, our first continuing education event was a pediatric mental health event. And in an effort to really focus on health equity throughout the year, we were pairing our clinician leaders with our community leaders for each CE offering. And so this was a virtual event that included Jason Estevez, who is the board chair of the Atlanta Public Schools Board of Education. I had worked with him in a different capacity previously, and he knew about my professional career, and he happens to be married to a nurse practitioner, so he is well aware of our profession and the kind of care and service that we provide to families. And so we invited him to join us and talk about what the school district was doing to support children's mental health last year while schools were largely virtual. And he has been just a wonderful advocate and leader throughout this entire year and moving into our current school year. The schools in Georgia did start about a month ago, so we're several weeks underway. And the Atlanta Public Schools has really been very proactive in implementing just about every area of priorities that Knapnapnap has outlined. So they are offering testing, on-site vaccinations, universal masking. They are encouraging quarantine for those who are exposed, and are putting out weekly information very transparently. So they are doing just about everything they can to encourage students and families to stay safe. And so we're really proud to have worked with Atlanta Public Schools and look forward to celebrating their success moving forward.
So the next step that we would like to talk about is how we communicate. And I think one of the most important things to remember is that certainly we communicate with, in-clinic patient education, or maybe it's not in the clinic, but you're, working in community health settings or within schools. But there are also quite a few opportunities to communicate in different ways with the community. So thinking about, emails, or follow-up phone calls is important, but also, attending meetings or webinars or community events and being a voice for, this multimodal approach is going to be really valuable. I think one of the ways that we can communicate that we often overlook is through social media. I don't know about you all. I'd be interested to hear, your opinions in the chat, but how many of you have seen just really horrible information pushed out in social media that's not accurate? I see it every single day. I'm a mom to two young girls, and the things that parents in our schools are posting are just not even close to being true. And that's what, all of our parents are reading. And so I think that being a voice in those platforms where maybe people are getting the wrong information can be one of the most valuable things that we can do, is providing really good evidence-based information to kind of counteract some of that rumble that you're hearing in the schools. I think also, when we think about this from a policy standpoint, being a good voice for policymakers and legislators to show, kind of the evidence of having this multimodal approach and the importance of it, understanding that our kids are very vulnerable and that they're more at risk for getting, these variants than they have been in the past, is something that should be driven home to local officials, state officials, and federal officials. And so being that voice is important. So I was just following through in the chat. Yeah, Judy, so, trying to replace information with true factual references to correct information on social media is so important. And again, I think that's the easy thing for us to do, and a great way to communicate. One of the things I think that's very valuable when we're thinking about our communication strategy is having a consistent message, but also thinking about who our audience is. So, certainly when we're talking to other healthcare providers, our tone is going to be very different than when we're talking to patients and their families, or when we're talking to community members. And so targeting that message, even though it's consistent and we're having the same approach, targeting it so it's appropriate for the audience is going to be very, very important. And again, thinking about those platforms. So, not just pushing it out in flyers in your clinics or hospitals, but really thinking about, attending events, putting it out on social media, writing letters to the editor, whatever it may be, really creates value. I think another important thing to remember is that, when you're thinking about these platforms and the consistent messaging, our messaging from Knapnap is the message that's also being sent out from the CDC and the American Academy of Pediatrics and lots of different other stakeholders that add real value. And so when we can partner with them and send out that message, not only from advanced practice nurses, but from pediatric healthcare providers or, general healthcare providers, it really adds a lot of value and power. We wanted to just highlight a chapter who's done a great job with communication. So in Michigan, the Michigan chapter tried to communicate to a variety of stakeholders about masking and about this multimodal approach. And so they reached out to the school board, to the county health department, to the state governor, and communicated in a variety of ways, as we discussed. So through emails, through verbal presentation, through written letters. And the result was that they had a vote supporting universal masking for K through 12 students, as well as staff and visitors during high, substantial, and moderate transmission of COVID in the community. So it wasn't exactly what they were asking for, but still a huge win. And they did that through just multiple modes of communication through a variety of platforms.
So basically, step 3 then is collaborate. So you've communicated, you've started to build relationships. The next step is to make formal or informal partnerships that you can build upon. The key thing is to find throughout the community. Don't limit yourself to other professional organizations. You can look at community organizations. You could the health department. Texas, the Dallas County Health Department has been a big partner. The healthcare community, you can look for the AAP or your local pediatrician organization, and families. Sometimes going through PTAs, organizations like that are also going to be very beneficial. The key is to align strategy, to find partners that that you can mesh with on the strategy that you're or the goal that you're particularly aiming for. So you can go to the next one. I have it here. This is a great tool. I don't know if you can see it, but this is a great tool, the building blocks for a child health coalition. It has really good, very basic steps, how to build a partnership, how to identify your strategy and goal, and how to find other coalition members. Remember, people that you may identify with on a particular mission or particular goal, they may not be somebody that you align with on another goal. So you can target your strategy to say mask wearing or vaccines, but they may actually have different goals in other areas. So targeting your message. And it's always important to remember that as a, yes, so the toolkit, yes. It's important to remember that you are not representing a political party. You are not representing your personal emotions. It's important to keep your emotions out of it, make this transactional and make it be passionate about what you believe in. But we are all representing children. We're representing our patients. We're representing nurse practitioners. So this is a professional relationship. So, you know, you just have to be very strategic and be able to partner with people on specific guidelines. For example, there's one example here where the Utah nurse practitioners got a thing passed, and they couldn't partner with the nurse practitioner, the larger nurse practitioner group, Knapnapnap of Utah. So they found the pediatricians and partnered with them. So you have to be strategic in your targeting of who you collaborate with. So this is actually supposed to be collaborate chapter highlights. But so in Texas is big. Texas is huge. We have 5 chapters just in Texas. So trying to communicate and coordinate is challenging. We're also, it's geographically very, very separate. So one of the things we did was to partner with the Texas Nurse Practitioners, TNP. TNP is a statewide organization. There are many, many, many chapters for Texas Nurse Practitioners. And they started a program that's called the Affiliates Program. And we checked with National Knapnap first. We talked to our local Knapnap area representative, which if you don't know who that is, you can ask Michelle or ask ask the main office of Knapnap. But before we did this, we did confirm it was okay, and we managed to make an affiliate agreement with TNP that respected our members' privacy. We didn't share share our member list, but we can share strategy. Our presidents of our Knapnap chapters for the state can be at the table with TNP talking about pediatric interests, because as I said with the Utah example, sometimes the larger Knapnap organization may not always strategically align with what we as Knapnap members want. You know, the AANP and local state chapters may not have the exact same strategy, but we can partner on certain things that will strategically align. So one of the things we did, it coordinated our state level interactions. It magnified our efforts, and the President's Council allowed all the Knapnap presidents to be at a table with everyone else. And the larger group that we became aligned with is the Coalition of Texans for Healthcare Access, and that is primarily for full practice authority in Texas. You may not know that Texas is one of only 12 states that still doesn't have, at least we're still a red state as far as practice authority. So I think it's important to pick your partner strategically and be flexible, be professional, and open to finding people who are going to carry the same agenda that you have.
And the last step in our framework here is to celebrate. And sometimes this one is the hardest to remember because we're all working hard and staying busy. But it's important to know in these times of high stress that we really need to celebrate the small wins. And we need to do that for ourselves, for our school leaders, our elected officials, our community partners, and our membership and the families that we work with. And so again, small wins are big just because change is gradual and policy progress is gradual, particularly for some of us in states where it's really challenging to move forward in the direction that we want to go with healthcare access and public health strategies. So first, with celebration, we can just begin by saying thank you. And I learned early on in my career, prior to even becoming a nurse practitioner, that people sometimes need to hear thank you 7 times before they truly believe it. And so we want to take every opportunity we can to thank everyone that's doing the good work and the hard work to join us in our efforts to keep children and families safe. And so we can do this in a number of ways through printed recognition in our emails, newsletters, on our websites, and our social media. We can praise people publicly when we have an opportunity through virtual events or some of our small gatherings that may be happening or within our workplaces. We can offer awards as recognition at the end of school years or at the end of our fiscal year, calendar year. Sometimes small gifts are appropriate, and we also have the opportunity to engage people in leadership opportunities, whether that's as a community partner through a formal collaboration or engaging some of our members in leadership within our chapters and larger organization. And so I just wanted to highlight 2 of the things that we've done in Texas and in Georgia. Texas had a great example of a long running awards program where they recognize state legislators for being advocates for nurse practitioner practice. And so over time, they've been able to recognize a number of people that have supported the profession in their state. And this is really wonderful because people become familiar with the award. It may incentivize them to support nurse practitioners. It helps build and strengthen those relationships and makes people feel valued and recognized for the work that they are doing to support the profession. Within Georgia, last year, we did develop and launch a new awards program to recognize an outstanding advocate and distinguished member in our chapter. And our outstanding advocate's actually on the call tonight. That's Dr. Melda Reyes. And we recognized her for her leadership in a number of organizations that's really serving to demonstrate our leadership within education and within diversifying our profession and within advancing policy initiatives in Georgia. And so it was really a wonderful opportunity for us to recognize her leadership and advocacy. And it's something that we look forward to doing now each and every year. But it's important to know that the celebration piece doesn't always have to be so formal. Those thank yous go a long way, just the personal, I really appreciate your effort. What you're doing is really making a difference in our chapter or in our community. And again, it strengthens that relationship within our organizations and with our community partners.
So, so with this, we're kind of wrapping up. I guess the best thing to do is it's really frustrating at times. It can be upsetting when we know what is really the safest, best thing for the kids, and sometimes you hit roadblocks, and we're all from states that are kind of challenged as far as trying to get our message across sometimes. But the thing to remember is just take it one step at a time. You are the experts in taking care of children. You are trusted nurses. Nurse practitioners are well-known and trusted advocates. So your message is important. And I had a couple quotes that I just thought were kind of pertinent. Be the change that you wish to see in the world, Gandhi. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. That's Margaret Mead. And education is the most powerful weapon which you can use to change the world. And that's Nelson Mandela. So we're all here. And when you find people who are all passionate about caring for kids and keeping them safe and keeping them healthy, then working together, you do celebrate when you make those wins, and we are making a difference. So you just keep up the fight. And I guess open discussion now. Has anyone got any questions? How do you feel now? Do you feel any better about kind of dipping your feet into the water of advocacy if you haven't yet done it? What are your challenges? Any kind of insights you can offer us, because we can all share with each other what our best practices are. So feel free to unmute, excuse me. So please, this is time for us to share. Everyone's shy. So does anyone have any questions for any of us, or any kind of observations, any obstacles? Parents asking for mask waivers. Oh my goodness. Now I've had people ask me for shot waivers, and if it's not, you know, medically necessary, I refer them. I say, you probably need to go somewhere else. But I've never heard of a mask waiver. Has anyone else on the call heard that?
I think that Sheehan is on the call. I don't, and if you want to unmute, because you had addressed, I think, some of these ideas as well, mask or vaccine exemptions.
Yeah, we've been getting a lot of questions in Michigan related to that. Specifically in my practice, the superintendents and the principals are sending people to the healthcare providers to get waivers. So I'm guessing because they are just so inundated with people wanting to be relieved from having to wear a mask. And the practice that I'm in is just very hard, fast, that if they don't meet that very restrictive criteria by the CDC, we just absolutely will not do it.
My population is primarily Medicaid and underserved, and I don't get that many. I get some people pushing back on vaccines, but I can see if you have severe respiratory problems and severe delays, and maybe you're agitated, I can see where there would be, but it's, again, CDC is very, very narrow. I always say, I go by whatever the guidelines are, and if you don't meet these guidelines, then I'm not the person to write that for you.
Right. Yeah, and that's exactly where we are in my practice. And my practice really runs the gamut as far as people that have lots of means down to people that have no means at all. So we're getting it from pretty much from all patients.
Now, I saw something pop up that in California, a doctor's license could be revoked for, I couldn't read the second half of it. What did that say?
They can take the licenses for unnecessary waivers.
Yeah, and I'm sure everyone knows of people who practices who will do whatever the parent asks them to do and writes whatever, you know, there may be even anti-vaxxer pediatric practices out there. I've heard of them. I don't know of any, you know, I'm not acquainted with any personally, but I've heard of some. And, you know, I think that's something that the professional organizations need to keep an eye on, because if you're not following, you know, the appropriate medical care and the CDC guidelines and all the appropriate, you know, evidence-based guidelines, then are you practicing, you know, according to, you know, what's safest for the children and best for the children. So that's pretty, I don't know. Again, I say, don't get upset, don't get frustrated, just keep fighting the good fight. But sometimes you just have to go and like count to 10 over in a corner somewhere and then come back to the fight, right? Anybody else have any comments?
I have a question kind of on that note. So we are just returning to school this week in Minnesota, and an argument I've heard against wearing masks in schools from some parents of kids with autism specifically is that wearing masks because they're not able to see other people's faces hurts their social emotional development. What do we say to parents like that? Like, you know, we know that masks protect their physical health, but how do we respond to that argument against furthering their social and emotional development?
I am very concerned. I worry about toddlers as well, because they don't see faces. My answer to that is that there are going to have to be opportunities in the home. You're going to have to reinforce your activities in the home within your pod of safe people as much as possible. But you have to kind of pick your battles. And sometimes it's really the safety of the child and making sure that they're okay. That has to be a priority. It's a difficult decision, but the decision has to be safety first, you know? So unless there's other issues, and the other possibility, the other thing I've heard is that sometimes kids who are deaf, kids who have hearing impairment and need to like see your face so that they can help understand what you're saying, that is also very challenging. So my response, that's, you know, and I think there's documents out there that talk about that, but I am worried about the long-term development, the effects of development on not being able to see faces for toddlers, any toddler, any socializing child in those really crucial windows of bonding with people. And it's just, you have to reinforce at home and try to find opportunities to be very face to face with your kids at home and do what you can to provide a stimulating environment, but pick safety.
Amanda, I think that one option that you could give parents or educators is, and Michelle actually just wrote what I was going to say, there are masks that are clear or have clear plastic areas. And I think, the longer this goes on, the smarter we're going to get. When this initially started, we were just trying to find any type of mask, right? And now we're starting to see some of these complications and coming up with innovative solutions to that. So a lot of schools, particularly for our younger kids who need to see mouths, or to your point, kids with developmental disabilities, will have schools that use these clear plastic masks so they can see mouths move and pick up on those social emotional cues as well.
And there's also WebEx things, and even though it's not the same as in person, having face-to-face on WebEx is at least you see other people's emotional, their expressions and try to get some of the key, some of the keys. Because my older son has Asperger's, so trying to get giving him social opportunities is challenging, and but you pick your battles.
Do you have any, going back to like talking to the school board? I think that I really like the example Jenny gave with Atlanta, and I'm thankful for school boards like that where you have leaders who are engaged with the right members of the community. And my chapter was talking to me really right before we came on here about like statewide, how we could collaborate in some way. And we don't have anything like TNP here in Alabama that I'm aware of that kind of unifies us. That's been a problem in Alabama for a while. So do you have any suggestions as far as anything we could do as statewide to help with some of the mask controversy and things like that? Or is it perhaps best that we're all just separately going to our own individual school districts and trying it that way?
Yeah, I think there's lots of different opportunities. In Georgia, we also have an organization called Voices for Georgia's Children, and they lead a child and adolescent health coalition. So they're a huge group that we participate in that already has pulled together all child and family serving groups within the state. And so we've participated and partnered on a number of different like social media campaigns and things like that with them. So seeing if there's a local nonprofit or community organization to work with would be great. Or you can reach out to some of your largest districts in the state and just introduce yourself, let them know that you want to be of service and support efforts that are being implemented, and see if there's an opportunity to participate in any school board meetings or perhaps convenings of some of the district leaders, because I'm sure they all get together. In Atlanta, all of the metro areas really work together. And so there'd be an opportunity to perhaps connect within the city groups, but perhaps their rural coalitions as well. So I think just reaching out locally and then asking those questions to get connected is a good way to start.
I think to build on what Jenny was saying, also there's power in numbers. And so the more you can draw in, different outside organizations, the more I think legislators and policymakers or elected school officials are going to pay attention, because those are the people who put them in office. So there's strength in numbers. And also, I think there's a really important message that we can all rally behind, which is that we want to keep kids healthy and in school, and focusing on that rather than getting caught in the weeds of the political polarization that oftentimes takes place on some of these board meetings is really important. And so the more people you can find that really just kind of can jump on this messaging of we want kids to be healthy, we want them to stay in school, I think the more powerful you are.
And that's important because, for example, in Texas, Beto O'Rourke he tweets out all the different meetings of the school boards. So if you're in that area, you can go. But that would be as a private citizen. You have to be very careful if you're representing a professional organization, or if you use the name of a professional organization, that you are conveying a message that's congruent. It's important to be very careful to be apolitical and not feel like you're supporting one legislator over another, especially if you're not acting as a large group. It sounds like Tennessee might be a little kind of fragmented. So the other thing that we did in Texas is, when I was president, we had we had each other's telephone numbers. We had a Facebook group that we looked at each other's Facebook groups, and sometimes we would message each other. It never became an organized phone call, but getting the presidents of the different, if you have more than one chapter in your state, getting the different presidents, or a board member from each of the chapters, get them to kind of communicate, and anything major, you can kind of shoot questions to each other. So that's another option. Just find out who's in charge of the other, NAPNAP chapters, just as a start, or who your NAPNAP national rep in that area is. That could be a place to start.
And I'm going to jump in here because Kathy's mentioned that twice. And I just wanted to make sure that everyone's clear, because not everyone on the call is a chapter officer. So chapter officers are probably more likely to know their executive board members at large. The executive board of NAPNAP has, I believe it's 6 members at large, and each member at large is assigned various SIGs and chapters, and to sort of be their liaison to the staff or to the executive board as needed. So the first point, if you're not a chapter officer, the first point for any member really should be check in with your chapter leaders, because they are the boots on the ground in your chapter and know really what's going on there much more clearly than we do at national. And so start there. And if you're not really getting the assistance that you need, everybody's busy. We have volunteer leaders and we respect that. You can always email to me, and I can be reached through marketing@knapnap.org or healthpolicy@knapnap.org, whatever is easiest for you. And I'd be happy then to help connect you with your leaders, or perhaps that member at large that Kathy mentioned. So that's a great opportunity. And earlier, Kathy mentioned about organizing with other groups. So NAPNAP definitely advocates for you to join groups that are like mind and principle and whatnot. And sometimes that means in child health, you might be partnering with AAP, which of course we don't always agree on scope. That's okay. Other times you might be partnering with an MP group and on a scope or practice type of issue. So you can have different alliances depending on the issues that you have. And there's nothing wrong with that. That's completely acceptable. But look beyond organizations. Think of like the Children's Defense Fund and March of Dimes and all these different groups who have local groups. American Heart Association and some of these groups also have some pediatric focuses here and there, and they have very strong, well-funded state level groups. So there's all different people that you can work with. Believe it or not, if it's an odd thing, but sometimes even like this, business bureaus and Rotary clubs and things like that are thinking about children's health, because if children are sick, people aren't working, the economy is suffering, and all these different things. So Mary Chesney, sort of a NAPNAP guru of advocacy, taught me years ago that don't be pigeonholed into just the health side. There's all these other groups that care about health, a little bit more remote than you would think, whatever, but they can be a part of your group. We are very amenable to those relationships for chapters to join those groups. We just really are careful that joining a group does not impact the chapter and any of its efforts and its independence and all those different things. And so TNP is a very strong state group, probably the strongest of any state nurse practitioner group. Many states have several nurse practitioner groups that can't organize. I think Florida might have 17 or something like that. At one time they did. But yes, Texas has been united, and that organization is quite large and quite powerful. So that one probably was a little bit tougher for our Texas chapters to join because of some of the things that they wanted. But other state MP groups are probably not as challenging or don't want as much from the Knapnap chapter, just that sort of joint advocacy. So feel free to get involved in those ways as well. And if you have more questions about that, please reach out. It's a little bit of a nuanced situation there, and it all depends on the different groups involved, but we want you to have partners. We want you to amplify your voice.
And one thing I will say, I was very careful when we were talking to the TMP group that the whole way through, once it became a possibility, that I talked to our state representative from the national board. I talked to Michelle. I had the whole, when we had an affiliate agreement, I had them look through it and we crossed out things, and TMP was very flexible because I think they wanted pediatric voices. They wanted us to come to their conferences and teach pediatric things. And so it was a very beneficial, but you have to be very mindful and strategic and work together as a group and make sure that what you're doing is aligns with your group's purpose and doesn't creep over into where you don't want to be. So, strategic, it's always about strategy, and you got to have a lot of dialogue with that. Ask for help from the national organization, because the AANP has partnered with Knapnap. You guys have partnered. It's a health policy day and those kind of things. So those things are possible. You just have to draw clear lines and stay within those.
Earlier, someone mentioned about helping to correct misinformation and perhaps to adolescents. I think somebody put something in the chat about teens are now being hesitant, and it's because they saw it on TikTok or something crazy. And so I actually put a link to a town hall that we had earlier this year featuring, I believe it was a pediatrician, fun gal. She was on social media, and then with a very simple immunization is great kind of message, and was just trolled and crazy things descended upon her on social media. But she gives these great resources and information about you can't walk away. Like the more people come after you, sort of the stronger you have to be. And that there's these networks of groups that are pro immunization that will help you if that happens to you. So it seems as though you need to be on social media to put forth that good information, that correct information, evidence-based. And sometimes that's intimidating because social media can just be intimidating no matter what, but then you always have to worry about some of those anti-vax sentiments. And so I definitely recommend that town hall. It's about 45 minutes or so. It's really informative.
And it's important. One of the things I always recommend, if you see negative, like bad information, don't forward it. Even if you want to send it to somebody, that magnifies it. You can, if you want to post on it, that's fine. But again, that if you're posting on boards that it's already, groups that are anti-vaxxers or whatever, you're probably talking to yourself, but don't magnify the voice. I don't know if does Knapnap have any kind of social media kind of I don't know, what would be like a committee or something that maybe if something really big came up that could be forwarded to them and they could keep like a
So we monitor different topics and whatnot and trends where we're seeing. And then we do some people screenshot, because as Kathy says, once you touch something, it then gives it more legs. The reach, the algorithms that are in social media are pretty crazy. And just by touching something, even if you hate it, that gives it voice, and it gives it, then all your friends know that you hated something, which then their friends know. And kind of crazy. So if you see something, feel free to screenshot it, or you do something, take a picture with your phone or something, and then you can always email it to us, and then we kind of keep an eye on it. And sometimes we as Knapnap will go on and post. Sometimes it's our member leaders who have a lot of reach in their social media profiles. We call those influencers. And so we'll use different techniques there. But there's really no database of all the horror, because that could be pretty big. I don't know if any of you know Patsy Stinchfield. She's an amazing infectious disease MP. And our representative to ACIP, just watching her during an ACIP meeting when all these crazy things are being said and she keeps smiling the whole time, it's just impressive. And so you sort of have to keep smiling and just keep giving out the facts.
Exactly. Because getting angry, I honestly think that's what some trolls really want you to do, is get angry. So you lose when you get angry. Plus, when you're angry, you're not thinking clearly. So you just think about the point. The point is saving kids and keeping them safe. That's what you're here for. Anything else is just a distraction. So. Anything else? Any other questions? I think we're pretty much done. So.
And we do have a few last resources on this page that we hope you will take a look at.